good morning. I'm Sharina Jane Dulay, caregiver, and I'm going to do the procedure of suctioning. The purpose of suctioning is to remove the secretions that obstruct the airway to the client. It also to facilitate the ventilation and to obtain secretions for diagnostic purposes and also to prevent infection that may occur from accumulated secretions to the client. Now, we're going to assess the client for any clinical signs indicating the need for suctioning. Those are the restlessness anxiety, noisy respirations, adventitious or the abnormal breath sounds when the chest is auscultated. Also, the change in mental status, skin color, rate and pattern of respirations, pulse rate and rhythm, and the decreased oxygen saturation. So, now we're gonna need the center. Sir, may I have your fingers? Sir, are you okay? Is anything bother you? Are you feeling restless? Let's see the skin color of yours. Now we're going to prepare the equipment for the procedure of suctioning. Now we have a towel or moisture-resistant pad. Also, we have the portable machine with tubing collection suction machine with tubing collection receptacle and suction pressure gauge. We can also use a wall suction if we have. And then a sterile disposable container for fluids. We also have the sterile normal saline or water. We also have the face shield, or we can use the goggles if it is appropriate. We have the moisture-resistant disposable bag and the sputum trap if specimen is to be collected. For the implementation of the procedure suctioning, we're gonna perform it by first, prior to the performing the procedure, we need to introduce ourselves and verify the client's identity using the agency protocol. Explain to the client what am I going to do, why it is necessary, and how he or she can participate. Inform the client that suctioning will relieve breathing difficulty and that the procedure is painless but may be uncomfortable and stimulate the cough, gog, and sneeze reflex. It is for the client to know that the procedure will relieve breathing problems is often reassuring and enlist the client's cooperation. Sir, I'm Sharina Jane Dulay, your caregiver, and I'm going to do a suctioning procedure for you. It is the purpose of it is to remove the secretions that obstruct the airway to your body and to facilitate the ventilation, to obtain secretions for diagnostic purposes, and also to prevent infections that may result from accumulated secretion. For the client's privacy, we need to close the door, close the window. So now we're gonna do hand washing. It is to prevent spreading of infectious diseases. And then we pat it dry. We use the towel to close the faucet to make our hands still clean. Now we're done doing the hand hygiene, so I'm going to wear gloves for the prevention of infectious diseases. So now we're going to prepare the client. If the client is a conscious person, we're going to position him who has a functional gag reflex in the semi-Fowler's position with the head turned to one side for oral suctioning or with the neck hyperextended for nasal suctioning. These positions facilitate the insertion of the catheter and help prevent aspirations of secretions. Since I'm using a doll, this doll is unconscious client. So, we're going to position an unconscious client in a lateral position facing me. This position will allow the tongue to fall forward so that it will not obstruct the catheter on insertion. The lateral position also facilitates the drainage of secretions from the pharynx and prevents the possibility of aspiration. So, sir, we're just going to do the lateral position. I'm going to put so that you will not be uncomfortable. So now we're going to place a towel or the moisture-resistant pad over the pillow or under the chin. It is to prevent the pillow from and the linens from soiling. Need to prepare the equipment. So we're going to turn the suction device on and set the appropriate negative pressure on the suction gauze. The amount of negative pressure should be high enough to clear the secretion but not too high, because putting it in too high of a pressure can cause the catheter to adhere to tracheal wall and cause irritation of trauma. A rule of thumb is to use the lowest amount of suction pressure needed to clear the secretion. So, I'm going to connect the suction tube. I'm done connecting the suction tube to the suction machine, so we're going to test it to know if it is functioning. For oral and oropharyngeal suction, we're going to apply clean gloves. We're gonna use our dominant hand for the sterile gloves. So now we're going to put sterile water or saline. I'm going to use the non-dominant hand. And I'm going to use my dominant hand, which has the sterile gloves, to get the catheter. So we're going to connect the catheter into the tubing. And then we try to, if it is working, we moisten the tip of the suction catheter with sterile water or saline to reduce the friction in access to the insertion. If necessary, we're going to pull the tongue forward using the gauge. So, we will not apply the suction during the insertion, because applying the suction during the insertion causes trauma to the mucous membrane. So, we're not going to put our fingers here during the application of the suction. We're going to advance the catheter about 10 to 15 cm or 4 to 6 inches long along one side of the mouth into the oropharynx. It is for directing the catheter along the side, prevents gaggling. It may be necessary during the oropharyngeal suction. It may be necessary during oropharyngeal suctioning to apply suction to secretion that collect in the mouth and beneath the tongue. So we're going to remove the gloves and perform hand hygiene after. So we're going to test the pressure of the suction and the patency of the catheter by applying my sterile glove finger or thumb to the port or open branch of the Y connector. So, if needed, apply or increase supplemental oxygen. We're going to lubricate the tip with sterile water or saline or water soluble lubricant. This reduces friction and eases insertion. Appropriate, we're going to remove the oxygen with the non-dominant hand, which is this hand, the non-dominant hand, if it is appropriate. But since it is not needed, I will not remove the nasal cannula. I'm going to perform the suctioning by applying my finger to the suction control port to start the suction and gently rotate the catheter. So, gently rotate the catheter. It is gentle rotation of the catheter ensures that all surfaces are reached and prevents trauma to any one area of the respiratory mucosa due to the prolonged suction. Apply the suction for 5 to 10 seconds while slowly withdrawing the catheter. Then remove your finger from the control and remove the catheter. Okay. Interpermanent suction reduces the occurrence of trauma or irritation to the trachea or the nasopharynx. So, a suction attempt should last only 10 to 15 seconds during this time, and then the catheter is inserted, the suction applied and discontinued, and the catheter removed. After we're done the suctioning, we're going to rinse the catheter and repeat suctioning as above if necessary. We're going to rinse and flush the catheter tubing with a sterile water saline. Relubricate the catheter and repeat the suctioning until the air passage is clear. So we're going to allow the sufficient time between each suction of ventilation and oxygenation, limit suctioning to 5 minutes in total. It is for applying suction for too long. Applying suction for too long may cause secretions to increase or may decrease the client's oxygen supply. So, now we're going to remove our gloves and throw the catheter with it. If it is not needed anymore, we can throw it now. If not, we can put it in a side bed or in a reachable area. If the client is a conscious person, we can encourage the client to breathe deeply and to cough between suctions. Use supplemental oxygen if appropriate, because coughing and deep breathing help carry secretion from the trachea and bronchi into the pharynx where they can be reached with the suction catheter. Deep breathing and supplemental oxygen replenish the oxygen supply that was decreased during the suctioning process. If obtaining a specimen is required, we're going to use a sputum trap as follows. We're going to attach the suction catheter to the tubing of the sputum trap, but I don't have sputum trap with me. Then we're going to attach the suction tubing to the sputum trap air vent, and we're going to suction the client. And the sputum trap will collect the mucus during the suctioning. We're going to remove the catheter from the client, disconnect the sputum trap tubing from the suction catheter, and remove the suction tubing from the trap air vent. We're going to connect the tubing of the sputum trap to the air vent. We're going to connect the tubing of the sputum trap to the air vent. This is to retain any microorganism in the sputum trap. We're also going to connect the suction catheter to the tubing and flush the catheter to remove secretions from the tubing. We need to promote the client's comfort by offering to assist the client with the oral or nasal hygiene. We also need to assist the client to a position that facilitates breathing. After that, we're going to dispose the catheter, gloves, water, and waste container. I already disposed it a while ago. We're going to rinse the suction tubing as needed by inserting the end of the tubing into the used water container. Since we're done disposing the catheter, gloves, water, and waste container, we're going to do the hand hygiene. So now we're gonna do hand washing. It is to prevent spreading of infectious diseases. And then we pat it dry. We use the towel to close the faucet to make our hands still clean. We also need to empty and rinse the suction collection container as needed or indicated by the protocol. We also need to change the suction tubing and container daily. We're also gonna need to ensure that the supplies are available for the next suctioning. Also gonna be needing to assess the effectiveness of the suctioning. So we're going to auscultate the client's breath sounds to ensure they are clear of secretions and observe skin color, dyspnea, level of anxiety, and the oxygen saturation levels. So now, when we're done with the procedure, we're going to document the relevant data. We're going to record the procedure by the amount, consistency, color, and odor of the sputum. Example is it is a foamy, white mucus, thick, green, tinted mucus, or blood-flecked mucus. We're also gonna need to record the client's respiratory status before and after the procedure. This may include the lung sound, rate and character of breathing, and also the oxygen saturation. If the procedure is carried out frequently, example, every hour, it may be appropriate to record only once or at the end of the shift. However, the frequency of the suctioning must be recorded as well. We also need to put our name and sign it for accountability. For the evaluation of the suctioning procedure, we need to conduct an appropriate follow-up such as the appearance of secretion suction, breath sounds, respiratory rate, rhythm, and depth, pulse rate and rhythm, and skin color. We also need to compare the findings from the previous assessment data if available. We also need to report the significant deviations from normal to the primary care provider.